Hello everyone, welcome to Dr. Chan's Minor Ailments Forum again. So in the last show we talked about dementia really briefly, just talking about how it's actually present, how it's diagnosed and how that affects people. And today I would like to get into more details of different causes that can potentially cause dementia. And the main topic that I want to talk about is Alzheimer's disease. Now, I'm sure many of you have heard about this condition and it's on TV all the time and in social media, so we're not, foreign to this idea. However, we might not actually know how Alzheimer's disease happens and what kind of symptoms or signs to look out for. So that's why I'm choosing this topic to kind of get into a little bit more detail so we understand a bit more. Now, just as a reminder, so in the last show I stated that dementia does not only affect your memory, but can also affect your higher executive functions, for example, thinking, problem solving, or even language. So Alzheimer's disease was founded by a physician named Alois Alzheimer. And according to the Alzheimer Society online, there are around 520,000 people in the UK with this condition. So it's actually quite prevalent. Now, let's see it as a molecular level, what actually is happening to our brain in patients who's got Alzheimer's disease, okay? So this condition is caused by the build-up of plaques and tangles in the brain. Now, that would in turn leading to loss of connections between the nerve cells, hence causing the symptoms that we see in patients with Alzheimer's. So I've been looking online to find easier way to explain what are the plaques and tangles and how it actually affects the connections between the nerve cells. So I came across a website called Alzheimer's Association. I really like the way that they explain what are the plaques and tangles, and it actually make me understand it even more. I can actually visualize how it's actually affecting the brain. So I thought I'll share that with you. So when the scientists look at the brain tissue under the microscope, they could actually see less nerve cells and synapses in the patient's brain with Alzheimer's when compared to the healthy brain cells. So just to clarify, that synapses are the junction between the nerve cells. That's how you communicate from cell to cell rather than having one massive nerve cell. So it's more efficient. So plaques are abnormal clusters of protein fragments and build up between the nerve cells. And the tangles are the dead and dying nerve cells, but they are made up of twisted strands of another protein. So if we look back to the plaques, they're actually made by a protein called beta amyloid. And if you look at it chemically, it's sticky. So what it does is they clump together. So these clumps may actually block the cell-to-cell connection and signaling at the synapses. Then it's causing an inflammatory response by our body, and this is how it's causing problem for cells to communicate. And the existence of the tangles actually destroy a vital cell transport system made of protein. So in a healthy cells, the transport system is straight line like a train track. So all the things that need to be transported, for example nutrients and so on and so forth, can go through the tract to another cells, for example. And a protein called tau, T-A-U, helps the tract to keep straight. Whereas in the case of tangles, tau will collapse into twisted strands and they become tangles. And the nutrients and other essential supplies can no longer go through these train tracks. So eventually the cells will die off. Now, in the previous show, we did talk about the symptoms of dementia, as Alzheimer's disease is part of dementia. So they would present with memory loss. I think that probably is quite early symptoms to look out for. For example, people can remember really well what happened 20 years ago, but they can't even remember what happened 5 minutes ago. Now, the reason is that the part of the brain that's affected in Alzheimer's disease is called the hippocampus. And hippocampus is in charge of day-to-day memory. And that's why they can remember things that happened ages ago, but they can't remember things that just happened. And it will become worse when time goes by. So another important thing to remember is that Alzheimer's disease is a progressive disease. So the earlier symptoms are mainly memory lapses or difficulty to recall things or learn new things. But it's important to bear in mind that not every single patient with Alzheimer's disease present in the same way or in the same order. So there are other aspects to look at. For example, language. The patient might not be able to follow a conversation or repeating themselves a lot. And it can also affect the visual spatial skills. So it means that they might not be able to judge distance or seeing things in 3D. And I find it really interesting how someone can see things in 2Ds, and not unless you've got that condition, you might not notice that's a problem. And quite commonly, it might be a case of the patient with the condition, but they weren't diagnosed and they found it really difficult to park or hitting cars when they're parking, etc. In addition, their concentration, planning or organizational skills could be affected, so they might not be able to make decisions or solving problems or even carrying out a sequence of tasks. So one of the tests that we do during a memory assessment would be asking a patient to follow instructions, but it's not just one step, we're talking about several steps. For example, pick up a piece of paper with your right hand and then fold it into half and put it on the floor. So there are 3 stages here. Well, for me and you, it seems like it's easy to do, but a patient with that condition might not be able to follow the instruction at all. Now, the orientation can be affected as well. So some patients might actually present it with going out to do shopping, going through the road that they know really well, and suddenly they don't remember how to come home. And because of all these happening, the mood can be affected as well, and they might get depressed and anxious. Now, as I stated earlier, this condition is a progressive condition. So not all these things will come on together. They might progress from several months to a year, but you can never say how long a patient will live with Alzheimer's disease. Some people can only live up to around 8 years or so in average after the diagnosis of Alzheimer's, but there are some that can live up to 20 years according to Alzheimer's Association. So when these symptoms keep on progressing and getting worse, these patients will become restless, having really poor sleep, maybe sleeping during the day and stay up all night and having hallucinations. And of course, these presentations can be very distressing for the patients and also for the family members or their carers. And eventually, this patient might lose awareness completely, so they'll stop eating and drinking and eventually needing 24 hours care. Now, while we're talking on this subject, I would just like to let you know that not all Alzheimer's disease happen when you're old. There are some atypical Alzheimer's presentation. They're called atypical Alzheimer's, in a sense that on a molecular level, it's still the same as the usual Alzheimer's. You still get the plaques and the tangles, but the part of the brain affected is not the hippocampus. So that's why they might not be presenting with a memory problem initially, but some other physical symptoms. In this show, I'm not going to get into details because they're very complicated, and it will take a long time to kind of talk about each of the atypical Alzheimer's, but there are generally 3 different types, and these patients mainly are affected by not being able to judge distance or spatial awareness or even languages. So it's worth to bear in mind that not anyone who get Alzheimer's presented in the same way, especially in those with atypical Alzheimer's that happen in a younger age, as in younger than 65, and the memory might not be affected first. So let's briefly talk about the risk factors of Alzheimer's disease. So all in all, in general, age is one of the main criteria. So anyone age above 65 years old, the risk would double every 5 years, and somehow affect women more than men, and is about 2 times more common in women than men in comparison. There's no real theory of why this is happening, but there's a theory of depletion of estrogen after the menopause could play a part in it. Now, once again, diagnosis of Alzheimer's disease is best to go and see your GP, because this is not something that you can just diagnose by yourself, because there's so many different things that can be contributing to all the presentation of the symptoms. For example, if you're lacking in some sort of chemicals, for example, B12 or ferritin or folate, it can make you anemic and also make you more confused than before. But actually, if you replace these chemicals, you'll get better. And so that's why we always do a set of blood tests, like a routine baseline blood, to make sure there's no organic problems that potentially we can treat and revert the symptoms. Now, I don't think nowadays when we send a patient to the memory clinic, they will actually take a sample of the brain to tell whether there's any plaques and tangles in the brain cells. However, the doctor who's running the memory clinics are very specialized. Some of them are neurologists, some of them are specialized GP who are interested in memory assessment, and they are able to collect all the details that we send to them and make a final diagnosis, whether this could be a let's say vascular dementia that caused by breaking down of the blood vessels in the brain, or is it caused by Alzheimer's disease, especially with the information from the CT brain scan. Now, don't be surprised that sometimes there's no clean-cut diagnosis of dementia. So quite a lot of the time, these patients will see the doctors at the memory clinic and come out having a diagnosis of mixed dementia. That would mean that you will have a collection of causes like vascular problem or Alzheimer's, etc. Now, treatment-wise, unfortunately, there are not any medication that can cure Alzheimer's at the moment. I hope that one day this medication will be available. I think the world will be a much better place and people won't suffer. But at the moment, the medications that we've got for Alzheimer's disease are only to help to alleviate the symptoms and to slow down the progression. So there are two different types of Alzheimer's treatment out there, and number one is acetylcholine esterase inhibitors, and the other one is NMDA receptor antagonists. Well, I'm not going to give you the name of the medication just in case that people think that I'm doing advertising, but these are the two types of medications that can help people with Alzheimer's, and I'll just briefly explain to you how they work. So the first one, acetylcholine esterase inhibitor, is to help to reduce the breakdown of a chemical called acetylcholine. And in patients with Alzheimer's disease, a drop of the level of the acetylcholine happens, and basically this is the chemical that we need to work between nerve cells as a communicator. And the other medication, the NMDA receptor antagonist, is basically trying to reduce a chemical glutamate release, because in patients with Alzheimer's there's an excessive release of a chemical called glutamate that can potentially cause more brain damage. It's hard to say which one works better than the other because the mechanisms are different, and it's quite a lot of time it's a trial and error to see which medication suits different people. I think the most important thing is with a patient with dementias or Alzheimer's is early diagnosis, because the sooner we can diagnose, the sooner we can get care in place for these patients, not just medication, but mainly care at home, for example, having extra carers coming into the house to keep the independence of the patient. I think that's the most important thing, because most of the patients that I talk to got diagnosed with this condition. The number one thing that they worry about is they have to go to a home, and that's not true. With a charity like Alzheimer's UK and Dementia Advisors and also the social work, all these patients with these diagnoses can actually live independently with extra care at home. But of course, without a diagnosis, all these things cannot be taken into place unless you're doing it privately. So I think the take-home message would be it's important to diagnose dementia or Alzheimer's disease early, so that implementations of care can be taken place and people can live safely and independently. And the most important thing that you need to do is, if you suspect anyone who's got this condition, or even yourself have got this condition, the most important thing is to go and see your GP for further advice and investigations. So until next week, take care of yourself. Bye-bye.